Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Think about this for a moment. Over 6 out of every 100 children in the United States have asthma.
Wow.
Yeah, that makes it the most common long-term illness in childhood. And it really makes you wonder, what could be in the air our youngest kids breathe that's making them more at risk?
It's a critical question, really. And it's exactly what a recent study took a close look at. The researchers asked, could being exposed early in life to ozone, that air pollutant that often goes above the healthy limits here in the U.S., could it be a major contributor to children developing asthma and those scary episodes of wheezing?
Right. So today we're diving deep into this important piece of research, which was just published in the journal JAMA Network Open. Our goal is, well, to understand what this study discovered, why it matters to you and your family, and what it makes us think about the very air our children are breathing during their earliest years.
Yeah.
We're specifically going to focus on how exposure to ozone in those first 2 years of life might be linked to breathing problems later on in early childhood.
And to get a really good handle on this, we're drawing information from a health news article out of the University of Washington and the original scientific paper itself, both from April 2025. They both offer, valuable perspectives.
Okay, so let's get into the study itself. What was the main thing these researchers were trying to figure out?
Well, the lead researcher, Logan Dearborn, and his team at the University of Washington were really interested in finding out if long-term exposure to ozone during a child's early years, specifically the first 2 years, increases their chances of developing asthma and experiencing wheezing.
Okay.
And they also wanted to see if the effects of ozone were, different depending on whether other common air pollutants were also around.
Right, the mixture. And where did they get all the information they needed for this study?
They used data from a really big program called the Environmental Influences on Child Health Outcomes, or ECHO. It's a large research project funded by the federal government. Pretty comprehensive stuff.
So who are the children that were part of this research?
The study included just over 1,100 children. They were from 6 cities across the U.S., including Seattle and Yakima.
Okay.
And all of these children were born from pregnancies considered low risk. Importantly, the researchers had access to info from surveys that caregivers filled out about, any asthma diagnoses or times the kids experienced wheezing. They also had detailed address histories for each child from birth until age 2. Then they had follow-up surveys about airway problems when the kids were 4 to 6 and again at 8 to 9 years old.
So they tracked them for a while.
Exactly. And they made sure to exclude any children born prematurely.
That sounds like a lot of detailed information.
Yeah.
So how did they figure out how much ozone these young children were actually exposed to?
Yeah, that was a crucial part. The researchers used a sophisticated method developed by Dr. Joel Kaufman to estimate the ozone exposure during those first 2 years. Basically, this method averages ozone levels every 2 weeks over a 24-hour period at each address where the child lived.
Okay, based on where they lived.
Right. And across all the kids, the average ozone level they were exposed to was about 26.1 parts per billion.
26.1 ppb.
Got it. And to understand those pollutant combinations, they used the same method to estimate exposure to nitrogen dioxide and find particulate matter too.
Okay, so they looked at the whole picture, and how did they determine if the children actually had asthma or were wheezing?
The main way was looking at those caregiver reports on a well-known survey, the International Study of Asthma and Allergies in Childhood.
Right.
They focused mainly on asthma and wheeze at ages 4 to 6. They defined current wheeze as any wheezing or whistling in the chest in the past 12 months.
Okay.
And current asthma was defined if the child met at least 2 out of 3 criteria. Ever having asthma, using asthma meds, or having current wheeze.
So pretty specific criteria.
Yeah, and they also looked at asthma and wheeze again when the children were older, 8 to 9, to see if things changed.
Okay, so after digging through all that data, what were the main findings? What did they actually discover?
Well, here's where it gets really concerning. The study showed that children exposed to higher levels of ozone in those first 2 years, even an increase of just 2 parts per billion.
Just 2?
Just 2 parts per billion, yeah. They had a significantly higher chance of having asthma and wheezing when they were between 4 and 6 years old.
How much higher?
The likelihood of having asthma increased by 31%, and the likelihood of wheezing increased by 30%.
Wow, 31% and 30%. That's a big jump for just 2 parts per billion.
It really is. A seemingly tiny increase translates to a very real and concerning jump in the likelihood of kids developing asthma. That's a key takeaway right there.
Definitely. But I think you mentioned earlier that this link didn't seem to hold up when the kids got older.
That's right. What was surprising and a bit puzzling is that they did not find a statistically significant connection between that early life ozone exposure and asthma or wheeze when the children were between 8 and 9 years old.
Huh. Okay, that is interesting. So what about the other pollutants they looked at? Did they seem to play a role in that mixture?
They did. When the researchers analyzed the mix of ozone, nitrogen dioxide, and fine particulate matter, ozone seemed to stand out.
How so?
Well, they noticed a higher chance of asthma when ozone levels were above about 25 parts per billion. And this seemed true regardless of the nitrogen dioxide levels.
Okay.
But they also found that the link between ozone and childhood asthma seems stronger when the levels of fine particulate matter, the PM2.5, were at or above the average level in their study.
So the other stuff matters too.
It suggests that the impact of ozone might actually depend on the presence of these other pollutants. So yeah, it's not just about ozone alone, it's about the whole cocktail of things kids are breathing.
Right, the combination.
Exactly. And there are more detailed statistical analysis, something called probit Bayesian kernel machine regrets.
Yeah, fancy stats.
Yeah. It basically helped them see how ozone interacted with the others and understand the overall trend better. They found that when they sort of held the other pollutants steady at their average levels, higher exposure to ozone, like in that 25 to 28 parts per billion range, was linked to both current asthma and wheeze.
Okay, that makes sense. And did the researchers have any ideas why this link seemed to vanish by the time the kids were 8 or 9?
Yeah, they offered a couple of possible explanations. One is just that asthma itself can change as children get older,
Uh,
Maybe fewer kids meet this strict definition for diagnosis at that age.
Sure.
Another possibility is that as children's lungs keep developing, maybe other things become more important, different risk factors, or maybe other pollutants they encounter later on, kind of overshadowing that early ozone effect.
Okay, so even if these effects are mainly seen in those early years, what does this actually mean for public health overall?
Well, even if the increased risk seems to lessen by later childhood, we can't just ignore it. Having a chronic breathing problem in those early years that comes with significant healthcare costs, and it puts a huge strain on families.
Absolutely.
Dealing with a young child who has asthma or is wheezing all the time, that's a major challenge for parents.
Yeah, absolutely. And it sounds like this study might have implications for how we think about and regulate air quality.
It really does. Current rules in the United States for ozone mainly focus on how high the levels get over short periods like an hour or 8 hours.
Right, those peak levels.
Exactly. This research suggests that we should also be thinking about limits for how much exposure children get over the long term, especially during those really critical early years when their lungs are developing so rapidly.
So it challenges the current approach a bit.
Yeah, it strongly suggests that just focusing on short-term ozone spikes might be missing a critical piece of the puzzle when it comes to kids' long-term respiratory health.
It makes you think about prevention, doesn't it? What can we actually do?
Absolutely. If being exposed to ozone early on really does increase the risk of childhood asthma, then finding ways to reduce that exposure, that could be a really important way to lower how many children develop this common illness.
Can you help us picture what that 2 parts per billion increase in ozone might actually look like in the real world for families? Is that a big swing?
That's a helpful question. While 2 parts per billion sounds tiny, depending on where you live, things like changing seasons, weather patterns, nearby traffic, industrial sources, they can easily cause ozone levels to fluctuate by that much or even more on different days or weeks.
Okay.
So for families living closer to busy roads or in areas with more industrial activity, even these seemingly small increases could add up over time and lead to higher overall exposure for the young kids during those crucial first 2 years.
Right, it accumulates. Now, like with any study, it's important to talk about limitations, right?
Yeah.
What did the researchers themselves point out?
That's correct. Definitely important. First, the study estimated ozone exposure based on outdoor levels at home addresses. They didn't have data on indoor air quality or personal air measurements.
And indoor air can be different.
It certainly can be. Second, the information about asthma and wheezing came from those caregiver surveys.
Right, self-reported.
Exactly. While they use standard surveys, there's always a chance of reporting bias. Parents might remember things slightly differently or interpret questions, in their own way.
Sure. Were there any other factors that might have influenced the results that maybe they couldn't fully account for?
Yes, there are always other potential confounders. Things like aspects of the indoor environment they didn't measure, or maybe other social and economic factors that differ geographically. These could have played a role. And while the researchers did try to control for many important factors, it's pretty much impossible to account for everything.
Yeah.
The fact that some of the links got weaker when they did sensitivity analyses, like excluding one group of kids or adjusting for more factors, that really shows how complex these relationships are.
It's good to keep those complexities in mind. What did the lead researcher, Logan Dearborn, say about the findings?
Well, Dearborn described that finding the link in younger kids, but not older ones, as puzzling.
Yeah.
But he and the team really emphasized that even if the effects are mainly noticeable early on, they're still significant because of the healthcare costs and the burden on families.
And they also mentioned the regulations aspect again.
Yes, Dearborn specifically pointed out that current U.S. ozone regulations only look at short time periods. He said their study implies we might need to start thinking about setting limits for longer-term exposure too, especially for young kids.
And it sounds like they see this as just one step in understanding the whole picture.
Absolutely. The researchers definitely called for more research to really figure out why that increased asthma risk isn't clear in the 8 to 9-year-olds. And to see if it could maybe reappear later, perhaps in the teen years. They also highlighted how their study adds to understanding pollutant mixtures and their effects, noting those patterns they saw with ozone when other pollutants were present.
So after this deep dive, what's the main takeaway or action item for our listeners?
I think the most important thing is for everyone to just be more aware of the air quality in their local area, especially during times when ozone levels tend to be higher, like, hot, sunny summer months.
And where can people find reliable info on local air quality?
The Environmental Protection Agency, the EPA, has a great website, airnow.gov. And many local or state health departments also provide daily reports and forecasts. Checking those resources is a really good idea.
Okay, so stay informed, good first step. What else should people be thinking about?
Well, I'd also encourage listeners to maybe think about the broader environmental factors, right, in their own communities that might be affecting kids' breathing.
Like what?
Like, are there major pollution sources nearby? Are there local discussions happening about improving air quality? Getting involved in those conversations, maybe advocating for cleaner air policies. That can really make a difference long term.
That's a really crucial point. So, as we wrap up today, this research really leaves you thinking. Given this evidence of how vulnerable our youngest children are to something as common as ozone, what's our responsibility here to truly understand and address the long-term impact of the air they breathe?
Right.
Even if some effects seem to fade, what other maybe less obvious temporary exposures early in life might be having lasting consequences we don't even see yet? It's definitely something to keep mulling over.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.